Welcome to Doctors on Call. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta.
I'm a cardiologist and I can tell you that there is an epidemic of heart disease across the world and especially in India. India is called the diabetes capital of the world. There's a very high incidence of high cholesterol, high blood pressure, smoking, and a whole host of other conditions that increase your risk of heart disease and also diabetes. So over the next few weeks, in these very special episodes of Doctors on Call, we're going to talk about some of these risk factors and what are some of the things that you can do to keep yourself healthy.
And you know what? Why not start with the most neglected one and actually the most common one, obesity. In fact, a recent study done in Lancet, which is a world-renowned journal, it actually showed that India is the third most obese country in the world.
I was reading that 1 in 6 adults across the world are obese. Now, obesity increases your risk of high blood pressure, high cholesterol, diabetes, and even increases the risk of cancers.
And what a lot of people don't know is that treating obesity can actually reverse a majority of these health issues. So today, on the first episode of this special series, let us look into how treating obesity can overall help your health.
Physical inactivity and a calorie-rich diet are one of the most common reasons for obesity. Diabetes is one of the most common effects of obesity. Insulin is a chemical in our body that is needed to process glucose. Obesity can lead to a condition called insulin resistance, where the body is not able to use the insulin properly, leading to high blood sugars and hence diabetes mellitus. This further increases the risk of heart disease and stroke. Obesity can also have an impact on the quality of life, leading to depression, anxiety, and social isolation. But losing weight can help improve your blood sugars and help lower the risk of complications of diabetes, like the buildup of plaque in the arteries of the heart and the body. This significantly reduces your risk of having a heart attack or a stroke in the brain. Losing weight also improves insulin resistance and lowers your blood sugars effectively. It also reduces the risk of sleep apnea, breathing disorder, and overall improves your energy and your mood. Let's hear what other doctors have to say about it.
People with obesity are at an increased risk of developing type 2 diabetes mellitus, heart disease, high blood pressure, increasing cholesterol, and stroke. Obesity is an important cause of insulin resistance, which is associated with diabetes. What do we mean by insulin resistance? Insulin resistance is a condition where cells of the body become resistant to the action of insulin, whose job is to control blood sugar. Therefore, if you reduce weight, you reduce your insulin resistance and blood sugar improves. In fact, it has been found that even modest degree of weight loss, we are only talking of 3 to 5% of the total body weight, improves blood sugar, reduces the need of taking anti-diabetic drugs, reduces your insulin requirement in people on insulin, prevents the progression of pre-diabetes to frank diabetes, and slows down the progression of diabetic complications.
Weight loss can also reduce the need for medications to control blood sugar, cholesterol, and blood pressure. So how much weight should we reduce to attain a better metabolic profile? The answer is just 5 to 10% of your current weight. This much amount of weight loss is good enough to bring about significant change in your blood sugar, cholesterol, and blood pressure. Individuals who have been diabetic for less than 5 years, weight loss of 10 to 15% can lead to remission of diabetes, as in these individuals can maintain normal blood sugars without taking medications. However, the blood sugars can start rising if the weight comes back. Hence, it is important to maintain the weight that has been lost. So what are the options for weight loss? The options that are available for weight loss are lifestyle management, weight loss medications, and bariatric surgery.
Losing even 5 to 10% of your body weight can significantly reduce your risk of having diabetes and heart disease.
And that is why it is time to get onto a healthy diet and an effective exercise plan to start losing those kilos.
I think that's all for now. See you next week.